Hey everyone, it's Dr. Hodges, and I'm super pumped. You know why? Today I'm getting some batteries for my selfie stick. Yay! This way I won't be constantly like changing my hands, and that I'll be doing on this video. Sorry you guys, so just bear with me. So I kind of want to do a little series on vitamins, which ones are good, which ones you really need, and I'm going to go by element by element for the specifics for bariatric patients. I cannot tell you how many patients will come to me and they don't like the smell, or they don't like the taste, or they don't like a chewable, or I only want to do a liquid, or whatever. I am telling you right now, you sound like, ooh, I just tripped. You sound like my 7-year-old. You need to know that if you do weight loss surgery, you have to take vitamins. Period. I literally have this conversation with Margie every morning because she doesn't like her Chewy, or if she does like her Chewy, she only wants it to be an orange. I could care less what specific brand that you take. It's just that you have to make sure that you get in these specific elements in whatever it is that you choose. If not, you will have issues, both short-term and long-term. And so I will then have some patients tell me, oh, I kind of sound like a mama this morning. I will then have some patients that will tell me, they're like, gosh, I didn't have to do some of this stuff whenever I was overweight. I'm like, you know what? That might be true. However, you probably had a whole other slew of things going on prior to your surgery that were also less than optimal. So sometimes it's like picking the better of two evils. And the reality is that even if you have not had weight loss surgery, you probably don't have a completely balanced diet, and you probably still need to be taking a lot of these same vitamins. In fact, most of the vitamins that I'm talking about, most Americans on a regular basis do not get everything that they need in the diet that they have, and so they still need to supplement with some type of vitamin on a daily basis, myself included. So with that, let's get started. We are going to start with some of the biggies. So all I'm going to talk today about is iron and iron deficiency anemia. And what does iron do? Iron lives on your little red blood cells, and it helps your body transport oxygen, which your body needs for basically every process in the body, okay? We are aerobic organisms. Aerobic meaning oxygen, and so you're gonna have the oxygen. If you don't have the oxygen, your brain's not gonna work, your body's not gonna work. The whole purpose that you have a heart is to pump blood so that oxygen can go to all the cells in your body. Our body needs the oxygen, i.e. our body needs the iron. Oh my goodness, I'm on like the busiest little road. Hang on one second, I'm gonna hit pause. All right. So, long story short, your body needs oxygen, and i.e. your body needs iron. So, what happens if your body doesn't get enough iron? Well, these are some of the common symptoms that you can get if you have an iron deficiency anemia. You can have fatigue, you can have hair loss, you can get brittle nails. I think the classic is spoon-shaped nails. But you can have brittle nails, brittle hair. You can also end up getting cravings for foods like ice. Some people will crave dirt. Some people will crave starch. Actually, there's this show that comes on, gosh, is it Netflix? It's called The Great, and it's a satire mini-series on Catherine the Great. And in that series, she's pregnant, and Catherine the Great was one of the czars of Russia, like way back in the day. So like in the 1800s, or maybe 1700s. Oh heavens, I can't remember. Anyway, way back then. And she was pregnant, and she had iron deficiency anemia, and literally all throughout her pregnancy, you see her, she'll be talking to people, and she bends down, and she's like cramming like a handful of dirt in her mouth, and they just look at her like, what do we do? She's like, okay, carrying on. So you can certainly have some weird cravings with an iron deficiency anemia. Some people might get a rash. I've had patients that will come to see me and they have, it's funny, these people always look at me like I'm crazy when I'm making these videos. Anyway, so also I've had a patient that came to me and he had a really weird rash on his hands, and that too was from an iron deficiency anemia. But probably the most common complaints that I will get if somebody has an iron deficiency anemia is that they have a profound fatigue or they're having hair loss. And so what is the cause of iron deficiency anemia? And the two main ways that I like to categorize it is you're either not getting enough in or you're losing it from somewhere. And to be very complete about a workup, you need to kind of rule out possible causes of both, because it may be a combination of both. So let's talk about getting it in. As a bariatric patient, you need to be getting in 45 to 60 milligrams of iron a day. Bariatric Advantage has a very good iron. Oh my gosh, it's almost too good. My favorite individual iron is the Bariatric Advantage Raspberry Chewy Bite. Oh my God, it's so good. Tastes just like a Tootsie Roll. And I'm sure if you've come into my clinic before and I see that you have a low iron, I've probably had a bottle of that stuff and I've like offered you one and it tastes just like a Tootsie Roll. My disclaimer, don't have too many, because technically taking an elemental iron can absolutely cause constipation. Another iron supplement that patients have told me about that I have seen an increase in their iron after they start taking it is there's one that's called Blood Builder, and they don't seem to have a lot of the adverse side effects such as constipation. That's the most common complaint that I will get with patients whenever I have to supplement with extra iron. But as a general rule of thumb, you need 45 milligrams to 60 milligrams of iron. If you are found to have low iron on a lab, we'll probably just initially start giving you extra iron supplement. And so let's talk about reason number one, why you might not be getting in. Why you not be getting in enough iron. Number one, it could be that you're just not taking it. So take your iron. And there are people that will have issues with constipation, and so they are very averse to taking extra iron, which is completely understandable. I have a lot of patients that come to me with chronic constipation, and that's whenever I think something, a lot of times if you can take a bariatric formulated vitamin that has iron already in it. Bariatric Advantage has a really good one. Fusion has a good one. Sometimes that formulation of iron can be less constipating. So you can do, oh golly, there are two all-in-ones with Bariatric Advantage. One is called Ultra Solo with iron. The other is the Advanced Multi-EA, and that's a chewable. I prefer the Ultra Solo with iron in the capsule form. I'm not super crazy about the chewable, but you can do the chewable. However, if you prefer a chewable, I really kind of recommend the Advanced Multi-EA. Bariatric Fusion also has an all-in-one, and it's cleverly called Multivitamin with iron. And it's a capsule that you do once a day. They also have an all-in-one that is a chewy, and you take 4 of those guys a day, and that literally has everything in it that you need. Multivitamin, iron, B12, vitamin D, and calcium, but you take 4 of those dudes a day. So, and I'll have links to those in this video, and you can just try and see what you like. So the simplest reason why you might not be getting enough iron in is that you're just not taking it. Now, sometimes you are taking it, but there can be things going on in your body that are preventing your body from absorbing it. And so it is not uncommon, for patients that have had a malabsorptive procedure such as a bypass or a duodenal switch, for them to be predisposed to having low iron. And the reason why is that when you have these procedures, we're bypassing the first portion of the small bowel called the duodenum. And the duodenum is where the majority of iron is absorbed. And that's one of the reasons why you just need to take more iron as a bariatric patient. Now, the other reason why you might not be absorbing all the iron that you normally take is you may also be taking a medicine to help to suppress your iron. Pardon me, to help to suppress your acid. So if you're taking an acid blocker, like a proton pump inhibitor, common proton pump inhibitors are omeprazole, Protonix, pantoprazole. Basically, if you go to the grocery store and you see azole, A-Z-O-L-E, you see that suffix at the end of the word, that means that that drug is a proton pump inhibitor or a PPI. And that also can inhibit your body's ability to actively absorb a lot of iron. Now, there's a variety of reasons why patients might need to be on a PPI, such as my patients, if you're 90 days out from surgery, I want you on a PPI. And that's just, you just take the good with the bad. And I'll be talking about that in another video. But that might be one of the reasons why you're not absorbing the iron, even when you're compliant with taking your iron. So, could be medicine, could be the surgery that you've had, it could be that you're just not taking enough. I also have plenty of patients that have told me they've always had issues with anemia, even when they've taken medicine. So it could just be something in your little body, just how God made you. So that's reason number one why you might not be getting enough iron in. And so how do you treat it if you're not getting enough iron in? Well, you take more iron. So you do that by beefing up the amount of iron that you're already taking. So if you're not taking any, you need to start taking the recommended amount, 45 to 60 milligrams a day, or your doctor may prescribe you an extra vitamin supplement, and I do that for patients, or sometimes I'll have you just double what you're already taking. It depends on where your iron is. Now, the other reason why patients might be iron deficient is that they're losing their iron from somewhere. And how do you lose your iron? Typically, it's going to be from a gut source, and it's usually from a GI bleed. Now, does that mean that you're blushing good blood from somewhere? No. But it could be that you have a little ulcer. It could be that you just have inflammation. It could be that you have a polyp in your colon. More commonly that I see is I will have ladies that have a very heavy or prolonged menstrual cycle. And so I look at somebody's age and I look at my ladies to see, you know, if they have a uterus. I ask them about their OB problems. So if I have a patient that comes to me and they have a very low iron and they're compliant with taking their iron, I will absolutely ask them, do you have a heavy cycle? If you're having OB-GYN issues, you need to go see your OB-GYN and get that thing checked out. Because it doesn't matter how much iron I give you, or if I even get you set up for iron infusions, if you're oh, there's a snake! Well, that was dead. God, hate snakes. If you, doesn't matter how much we give you, if you're losing blood faster than you can replete it, you're gonna have a deficiency. If you are 45, the age of 45 or more, and you either haven't had your screening colonoscopy or one is due, then you probably need to go get your screening colonoscopy. It does not mean that you have cancer. I do not want you to think that at all. But if you have fairly low iron, then you need to get that thing checked out. Ooh. Everybody's getting their yard set. Hang on one more second. So let's take a little case example. My sweet husband, he had a screening colonoscopy or his routine colonoscopy about 14 months ago. He went to his primary care doctor and he had all his labs drawn, and his hemoglobin, hematocrit, that's his blood levels, and his iron was a bit low. His protein was also low. Now, his PCP, who's not used to working with bariatric patients, was like, you need to get an upper and lower endoscopy stat. You gotta get things checked out. You might have an ulcer, you might have a bleeding polyp. When I saw that, and I know his history, and I'm a bariatric surgeon, and I know that he's had a gastric bypass, the first thing I tell him is, dude, you gotta start taking extra iron, and you have to start taking your protein, period. No ifs, ands, or buts, because his protein was like 6.1, and I like it to be closer to 7. I also know that he has no symptoms of epigastric pain, so pain like in his chest, so he doesn't have any symptoms of reflux. And I also know that he just had a colonoscopy about a year ago. So, and he doesn't complain of black tarry stools. He doesn't complain of blood in his stool. So the risk of him bleeding out from somewhere is going to be much lower. So as a reason for his iron deficiency anemia, as opposed to him just not getting enough in, because that was one other thing. If you're not doing your protein, it can certainly affect your iron levels. So my recommendation for him, as his wife and a person that does bariatrics, is you need to beef up your protein intake. You got to beef up your iron intake. I would recommend getting another iron study in 6 weeks. And if we've seen improvement, then more than likely it was that the reason of your deficiency was because you're not getting enough in, or you're not absorbing it, not necessarily that you're losing it from somewhere. Now, that is just one example. There are a plethora of reasons, and so I would really recommend that if you're finding that you're iron deficient, your blood levels are low, your iron levels are low, the very first thing you need to start doing is just start taking your iron if you aren't already, or at the very least start doubling it, and then make a follow-up appointment with your bariatric surgeon. Sometimes your bariatric surgeon will just have you talk with the nutritionist or their PA. Either way, I would recommend that you go see your bariatrician, and then kind of go from there. It's not also uncommon for me to have the occasional patient that, they have no GI issues. I still might do an upper and lower endoscopy. Everything's stone cold normal. And so I end up just sending them to go get an iron infusion. So that's another option. Especially if people are not tolerating oral iron supplementation very well. So I hope that this has been helpful for you guys. I know that this is a longer video than what I normally do. Iron is a really big, hot topic. I am looking at it, and if there's an issue with my patient's nutrition, and if they're presenting to me with a nutritional deficiency, iron is probably one of the most common deficiencies I'll run into. So I hope that this has helped. Please share this with your friends, especially if they're having issues or complaints with their iron levels. Hope this helped.